Everyone, and welcome to the Dandy Soap Herb Shop channel. I'm Elizabeth, and I have been talking to you about inflammatory breast cancer and ductal carcinoma. I was diagnosed in June, and so today I want to cover what these chemotherapy medicines I am taking or they're administering to me for my treatment of my cancer and what they are and where they're derived from. That may make you feel a little better. It did me because I am an herbalist and I am a Christian woman. I believe in God and I believe in His medicines. I believe the Bible when it says that He has placed a antidote for every single sickness to mankind on the face of the earth, that it is here and it exists. I also have to believe that He has gifted people to have information and knowledge, including doctors, even though I'm very cynical. And the older I get, the more cynical I become. So today we're going to talk about chemotherapy medication. What is it? What's it consist of? The first one that I've been given is they call this Red Devil. Now this is a two-layer type of chemotherapy. It is doxorubicin and also Cytoxan. So the the other names you will hear the other names given, and I'm giving you the short version name of them. The doxorubicin, or what you call hang on a minute. So doxorubicin, which is also adriamycin that you may have heard, that is actually a very, very strong, I mean, like, it is a max strength potent antibiotic. That is literally, if you Google it and look it up, even if you follow that and see the scientific breakdown of it, it is actually called an antibiotic. And the way that that works is, imagine something so strong that supposedly the cell, the cancer cell, will engulf itself. It will rip itself apart because it would cause such chaos. So if you are truly, as you know, antibiotics kill good and bad bacteria. So it is like, say, pouring alcohol on it. We know that removes good and bad bacteria. So that's what that medication does. But it is so strong that your body has to be able to tolerate it. And some people we know have allergic reactions to all medications, and antibiotic is a severe medication. This is like giving such a potent, it is like letting off a bomb inside that human body. You have literally just set off TNT inside that human being. Um, so you can look it up, read into it, find more information. But that's just kind of my analogy, or the best way I know to break it down and describe it to you. All right, the other part was Cytoxan, as I told you about. You can pronounce that big long word, cyllophasphamide. And it is Cytoxan. Now, Cytoxan is mustard gas. Mm-hmm. Yep, just like what they did in the war. It killed many people and severely messed up soldiers being exposed to mustard gas. So now you understand why they they put on a hazmat, biohazard, and cover themselves and try to keep you safe, and why it's being plugged into you straight into your bloodstream with hopes that you will tolerate it. And they're going to know that by your first visit. Trust me, they're going to know right away. And a lot of times they will also do a line that's going in at the same time as these medications that is fluid, regular IV fluid. So you'll have saline going in along with it, which kind of basically just liquefies it and, kind of thins it down so that your body might be able to tolerate it better. Some people will have such bad reactions that it can take up to 8 hours for them to take the chemotherapy. And I know that's how maddening it is that they will literally, you have this person having allergic reactions, just not tolerating it very well, that they will put this down to a slow drip trying to get it into their bloodstream. That is what I'm talking about. They're putting a poison in your body, and it's going directly right above your heart. So this catheter goes up, is pierced into my jugular vein, run down the right side of my heart, and it stops just above the opening of my heart valve. So when they're feeding that medicine into you, it's going straight in your bloodstream. Now, oddly enough, I know I was talking about it burning you and doing terrible things to you. You're, for whatever reason, you can go straight into the bloodstream and it's tolerable. You can handle it. Your body can handle it versus it getting on your skin. And it just tells you how incredible the vessel that you walk around in, that we call our human being body, how unique it is and how it's able to tolerate things. So your fight, so to speak, they call fighting cancer, it ain't fighting cancer. You're just trying to stop and turn off something that got turned on and got malfunctioned in there. I don't like the word fight. You may, and I hope that you don't judge me for that. Um, just kind of give me a grace and say, oh well, that's her opinion. There's no such thing as fighting. No, this is something that can kill you. You can call it fighting if you want to. The way I see it, I want to stop it. I want to eliminate it. I want it to go back to dormancy. It's no different than people trying to fight weeds growing. There are certain weeds that need to grow because they are beneficial and they're actually an herb and they're medicine to us. But everything has a reason for its existence. Everything has a reason. I don't know why cancer. I just know that the big pharma and doctors make such money off of it. They are greedy devils. That there have been cures for cancer for decades. Decades. And I want you to know that some of these unorthodox things that people are making fun of that are dog worming medicine, they kill cancer. But they can't even figure out how or why. But I want you to know that just like this is mustard gas, part of this chemo I take, this layered chemo I take, part of it's mustard gas. All right, they harmed our own soldiers with it. They killed other soldiers with it, exposure to it, and then they treated them in the VA hospital. Well, guess what? These unorthodox methods of killing cancer, they done that in the VA hospital. They were curing cancer in the 70s. So when these boys came back from Vietnam War after being exposed to God everything and mustard gas and have cancer, they killed cancer with these unorthodox methods. Okay, and I will discuss them with you later. So let's move on to the next part. Now, when I get to my stage 2 part and start on my 5th cycle of chemotherapy, that will be treated with the Taxol I was telling you about. And it's Paclitaxel is the brand name, which is no longer approved to be used here in the U.S. But the generic of it, called Taxol, is. And that is what will be administered to me weekly for 12 weeks. So it is, where does it come from? Taxol is derived from the a type of fungi that is mold and grows on the bark of the yew tree. So Taxol actually comes from the yew tree, YEW tree, and is highly poisonous, and that's what it goes in. The thing with it and the side effects are very frightening to me. I did not want to take chemotherapy. If I prayed hard, if I've ever prayed hard in my life, I did not want to have to take chemotherapy. I really just wanted to go to surgery, take this tumor out of me, and after I heal from that, everything will be okay. And then maybe, I, honest to God, did not foresee that I was going to have to endure not only chemotherapy, but in my future, radiation after I've had surgery. So they'll do this chemotherapy to the max amount, then they'll do surgery, and then radiation. So my brain keeps thinking, okay, hey, when, can we revisit screening me, doing a scan on me to see that tumor has shrunk and what size is it going to be, satisfy y'all's ass to do the damn surgery on me so I do not have to endure any more chemotherapy. So all these thoughts will go through your mind as well. I'm also wanting to know, why am I going to have radiation? Well, it's because these rogue cells. Now imagine they open you up, your your blood wants to clot, so you're going to have white and red blood cells rushing to those wounds, wanting to try and heal your body immediately after, while you're being, anytime you have a wound, a scratch, a boo boo, a bite, your body automatically goes to healing. So guess what? Those rogue cancer cells will rush over there and fly to it, just like your red blood cells and your white blood cells. So to clean up the chest wall and hopefully kill off any rogue cancer that might have somehow escaped during the surgery and them determine these margins, they do with the radiation. That's what that's about. Meantime, they're going to check those tumors and the lymph nodes and everything else after. And hopefully they'll be checking that during your surgery, so they'll make sure that they remove all of them that are infected at the time of your surgery. And they'll have all this treatment plan laid out. Mine is neoadjuvant treatment, meaning, I'm doing the chemo and then the surgery and the radiation and then these pills. So there's so much more that is involved in your cancer treatment. It's really a complicated, um, professionally laid out type thing. And just bear in mind that we have advanced to the fact that used to, when you had to take chemotherapy, you literally were admitted into the hospital and administered chemotherapy, and they did it like back to back, like every single day. So you stayed very, very sick, and you weren't allowed to go home. There wasn't a rest state. They pushed you till near death there, and then they would back off and let your body recoup, and then they start administering chemo again. Also, we're even more advanced because prior to then, your chemotherapy was actually cobalt. They would run cobalt directly. Could you imagine cobalt running through your body? I can't even imagine that. But there are a lot of people who endured that treatment, cured their cancer, and they lived, and they're still alive. I know a lady right now is 88 years old. And when she had breast cancer, that's what they did to her, is cobalt. And she still has her breast. They didn't remove her breast. They didn't cut nothing. Nothing. They just treated her with cobalt and cured her cancer. And she still has breasts. So that's why I'm saying to you is you have no way of knowing exactly what they're going. I know that surgery's in the program for me. That's what they're planning on doing. So I want to know, will it still require a mastectomy? Will I still have to endure that? Or will it be a lumpectomy? There are some people who are diagnosed with the same thing as me, and they figure out, oh, well, maybe they didn't have inflammatory breast cancer, but by locally looking at it, they have diagnosed you with inflammatory breast cancer. That's what they did to me, which means my breasts are gone. But if they come into your program and they start realizing, oh, well, this patient doesn't have what we originally diagnosed, and they do a lumpectomy, so that's good news. And that does happen. It really does. So don't think, oh, well, there's no other chance for man that nothing could change, because it very well can. And you can be the exception to the rule. Be proud of that, be excited about it, and pray for it. It's all unnatural. So I just wanted to tell you what these chemos are, what type of medicine it is, and symptoms that go along with it. They are not pleasant at all. With the red devil, for me, chronic fatigue, shaking, motor skills being affected, nausea, and constipation. So, what happens though is by the time you get to, say, your third treatment, you already know, before you even take that third treatment, what you can expect on the red devil one. So, you already know how long it will take for your fatigue, for you to be able to get to where you can do something and function. You'll also know how to combat your nausea and or vomiting. You also know how to combat your constipation, and you will know how important it is to stay hydrated, to eat good foods, to fill your body up with lots and lots of vegetables. and make sure you got fruit going on in there and that you're getting high amounts of protein. You will have learned all these things by the time you have your third one. And just like me, when I take my fourth chemo, I know what to expect. I know how long it's going to take before I am able to do what I'm doing right now. Sit here, talk to you, do a video, um, and have some color about myself, have energy, and feel next to that, to normal, as normal as you can, considering. And I'm not shaking. My nerves and my motors are working. I'm able to form letters. I'm able to talk to you. I'm able to keep both my eyes open, and no more shakes, no more vibrating. Now, if I was to get up, mess around, start doing things, I'm going to get fatigued. That juice is going to run out pretty quick. Your energy depletes really, really fast. Um, but I have done it. And I will tell you, when they tell you, move as much as you can. Now, your first 4 or 5 days, do what you can. Get into the bathroom, eat your food, take naps, whatever you got to do. Just really, really take care of yourself that first 5 days. Don't even try to be brave and strong. Oh, I can go lift weights or whatever. If you're my age, that's insane. Okay. But if you're young and you feel like you can, well, you go ahead, old froggy there. Have a good time. Enjoy yourself. But I tell you, that first 5 days, give yourself grace. 6, 7, and 8, 9, those next 4 days, they'll get a little better. And then by the time you reach your third chemo treatment, you're going to be looking forward to them honey days. You'll be like, ooh, I get past day 9 and I'm good to go. Um, you'll have more energy, and you'll know it'll run out fast. You know that your nerves are shaking. You know you're going to have all these tremors and vibrating, heart racing, and all those. And you know to keep an eye on your temperature and make sure you're not exposing yourself or your family, because your family's dealing with cancer too. Every one of them have cancer. If you have cancer, they have cancer, because they're doing what you did do when before your cancer diagnosis, and they're taking up that slack. So have mercy on them, and be very appreciative and grateful, and love them very much because they love you and they're doing these things for you. So just bear that in mind, that some of us, some of them, they will have to go through certain things, and so will you. And you'll all learn from each other. You'll learn your strengths, you'll learn your weaknesses, and you'll know what you can and can't do. You'll figure it out real fast. But do know that you will have those days of rest time on the Red Devil. And when you get to the next stage of your chemotherapy, which is what's happened to me, the Taxol, and dealing with it, I know some of the symptoms that I've read about, that they give you pamphlets and information and brochures and all kinds of reading material. The breast cancer book, if you're issued that, read it. Read it. Everything you could possibly ask, that lady has covered. She is amazing. It is one of the best books that you'll ever come across. And I mean, it will show you how surgery is done. It will show you, it'll answer everything you possibly can about breast cancer. And it is a good thick book, but it's so informative. It'll really keep you engrossed in it. Trust me. And the way she's got that book laid out, some parts are covered. I feel like she did that on purpose, and it's what you will need at that time. It's what you need answered. It's questions you have. So by the time you get to that part, you will be able to set that book down for a while and just walk away. Um, and then from that point, when you start reading again, you'll go back over some stuff that she already told you in the book. You'll reread it. And then as you go forward through the pages, you go, oh, well, she's covered that too. And I'm telling you, she wrote that book. She knows exactly what you're going to need when you need it, and answer the questions that you're needing answers to. And you'll be ready to accept that information. You'll be ready to absorb it and take it in and digest it, because the way she's got her book laid out, she knows. And it was perfect timing, because when I went back to the book at the page I stopped on, that's exactly the answers I was looking for. I was like, oh, well, this shows me. I couldn't have Googled that. I couldn't have found that in a blog, and I sure as heck wouldn't have found it on a YouTube video. Her book is literally wrote for you. if you have breast cancer, that book's wrote for you. It's going to be all the answers that you need in that one book. And it is amazing. And she keeps it revised and updated. So no matter when you see this video, you'll see, if you're in the United States, you'll be given that book. Most of the time, they give you that book. They don't charge you for it. They give you that book and read it. And there's also one for the providers, your caregivers, those who are taking care of a loved one with cancer. There's a book, and you can buy it separately. I have not bought yet. I'll be honest with you. I have received so much love and support from my husband and my daughter and other family members that I'm close to, friends that have become close friends now. They were merely a friend, but almost close to an acquaintance. Just, we didn't like ever see each other. We didn't go like visit with each other or anything, but we would talk through video and stuff. And they have become real close friends. And I'm telling you, I I am amazed. I am just so blessed at the love and support that I've been given. Um, my marriage has improved because he hears me now. And maybe he's thought, wow, I never thought about the possibility, that she could get something that would take her away. And so he looks at me differently. He listens to me more closely. He is forgiving when I'm upset or something's got me riled up. I don't fuss as much as I did before either because, well, most of the time I'm just sick, and even though when you get older you don't fuss and argue about stuff as much as you did when you were young, because you already know your time's limited and it just ain't worth the energy. It ain't worth all that. Just just let it go and move on. And when you have cancer, you let go of a lot more and just move on. It's just not worth the argument, the discussion. Just throw it at the wall, see what sticks. That's all I can tell you on that. Your opinion changes. Your need for affirmation and confirmation changes. It's no longer a big deal, really. Um, and you would just rather be at peace and have peace. Because, for one, a lot of times you're sick and fatigued. So you really don't care. You just want to be okay. You don't want to be sick and you don't want to be fatigued. Anything that's going on outside of that, you really don't. You don't even make yourself part of it because you're just too sick and too fatigued. You're just not in the game. You're just not in the fight. And as I said before, my opinion about this whole fighting cancer, no, I just want it to go dormant again. There's no such thing as fighting it. The bastard's already won. I want it to just go back to sleep. I want it to be that sleeping dragon that does not wake up, that stays asleep for hundreds and hundreds and hundreds of years. I want it to go to sleep. I want to slay the dragon, or I want it to go to sleep. I'd rather not, you know, say this whole fight thing. I just really don't. Or this whole kick cancer's ass. No, cancer's kicking my ass. You got it wrong. Y'all's analogy of this, I don't know who came up with that fighting cancer. I don't know who came up with that analogy of kicking cancer's ass. I don't know who came up with this whole FUCK cancer. To me, that's kind of stupid because we all have it. The difference is if it wakes up, if it starts actually killing you and your own cell turning against you. Because no one says anything about fight autoimmune, do they? What is autoimmune? That is when your own immune system turns against you and it is killing you. Your own cells have begun to turn against you and they are killing you. And they keep you sick and they keep you from being well. And they're constantly picking on you, constantly bullying you. That's what cancer does. Cancer is just a worse case. Cancer is something that has woke up and it can literally kill you. Autoimmune system, people can live with autoimmune. People can live with HIV. Cancer, that is something that's just come awake, and it is just malformed, and it keeps duplicating itself 1,000 times faster than your normal blood cells. So that whole fight thing, I don't get it. I don't think I should be at war with something that's inside of me that's living there all the time. And for whatever reason, it's gone rogue and decided, oh, it's going to go, just destroy me. When I've been toting it around, there's no way of not toting it around. We're all born with it. So whether it cuts on or cuts off, I just want it to go back to sleep, and I want to stay asleep forever. Um, I don't want to have to deal with this again. I don't want to have to go through this misery again. I pray that no one would have to. It would be my desire that these people who do know the cures for cancer to give that out like candy, willingly, without anybody having to do any arguing or fighting or getting on here trying to say, well, I done this and it cured my cancer. I done that and it cured my cancer. Just be okay with that. And if it's unorthodox, it's worth a try. If you think it will help you, if you agree with this person's idea or belief or whatever system they tried, and you feel like it will help you, I grant you, I will tell you do it. I don't care what it is, how crazy it seems. If it says run out at midnight and do 10 circles backwards and fall down on the ground and bury something and it will cure cancer, I don't care how crazy it sounds. There is nothing crazy about curing cancer. Nothing. There's nothing unreasonable. There's nothing that should be taken off the table if suggestions or considerations. Consider it all. Look into all of it. Do your own investigating and check it out. And don't discount any of it. Until the next video, when I am full of vinegar and gasoline and spitting fire and feeling good again, this is Elizabeth. Be sure to subscribe. Make sure that if you would like to have a cancer support package, to contact me. If you just want to talk to me, you have questions you feel like I can answer, or if you just need someone to listen to you that's going through the same situation and offer you some comfort, do check out the information below. I do give my website to my business, but it's if you go over there and check out the website, you will see the phone number, you will see the email address, at all that. I usually put that underneath this video anyway, but it'll give you the phone number. So I figure if you take the time to go over there and check it out and get the phone number, you can call me or you can reach out to me by email, either way, or contact me through the website, which works like a text chat, and I'll be glad to talk to you. So I do put that information there and make that offer to you because I sincerely mean it. And sometimes you just need somebody who's dealing with it too. And just know there is no such thing as overreacting. Overreact. Get mad, cry, you're going to be sad, you're going to be fighting depression. You may have to have something for anxiety. You may have to have something for your nerves. You may have to go to therapy. All that's available to you. And so take it. Take it. If that's what you need, take it. I'm probably going to look into the therapy part. I do take, I, they give me Ativan, but in the beginning I was using that when I would get upset. Now I have been given permission. I made sure, like I didn't even think of it. My husband suggested it, and then the nurses actually like gave their seal of approval, like, oh yeah, if you got some Ativan, girl, kick it. Yeah, take that before you come for these treatments. Absolutely. Because it's difficult for me. The anxiety, just knowing I gotta go for my treatment and just going is very upsetting for me, and I get very anxious, and it's hard for me to sit there and take that treatment, and I'm just like, I just want to get it over with. I want to get in and out there. I just want to go, and it just takes so long to take the treatment. I mean, you're talking 3.5, 4 hours of your life. You're like, oh my God, you're just there, and so your anxiety just gets heightened. The longer you have to be there. And just knowing that's going, just knowing you have to go to that facility, just having to go there, your anxiety is off the chain. It's just running off the scale. Trust me. Um, you just want to get it over with. You just don't want to have to deal with it. And then the fact that this upcoming one I've got is Taxol. That one has bad side effects. Like you could lose your fingernails, your toenails, affects your nerves, causes nerve damage to your fingers and toes. Wearing cold packs, wear them on your fingers and hands. Some people wear cold packs on their head to keep their hair from falling out. Um, and some people it works for, and some people don't. And a lot of times it's so strong it's going to happen anyway. That's a dead skin cell. So your hair is going to come off. I've lost hair in my nose, so my nose runs a lot. I've lost hair within your ear, the little tiny hairs that's down in your ear. So I feel like I have swimmer's ear, or like there's water in my ear all the time on my right side. So you drain, because there's no hair or nothing to catch that. I have no my facial hair, whiskers and lip hair. My eyebrows are getting thin, so I figure a couple more treatments, and I'm probably going to lose a lot of that. I know a lot of my eyelashes have come off, so this eye will leak sometimes, like just constantly run, and then other times it's okay. Um, of course, you've lost your private hair, your armpit hair, and then you'll start losing hair on legs and arms and other places too. Because, like I said, my face, well, hair is already gone, and these are already coming from the Red Devil treatment. So the Taxol, um, the nerve the having neuropathy and nerve damage in your fingers and toes, they have you to wear these cold packs with hopes that will prevent that from happening. Almost like it stops the chemo from going that far. Well, I do not like cold, never have been a fan of cold. So I know I'm going to have problems with that. That's going to be definitely difficult for me because you've got to take your hands in and out and your feet in and out just so you can tolerate it. Um, but you have to start using the cold packs 15 minutes prior to the treatment starting, and then you're going to have to endure the treatment for an hour. So, an hour and 15 minutes, you're wearing these cold packs, just trying to keep chemo from going to those nerve endings to somehow save your nerves in your fingers and feet. The pain that comes from nerve pain, um, I'm not, that's another thing. And also, they state that you basically stay nauseated the whole time you take that. The fact that it's going to be happening every week, I tell you right now, I can handle fatigue, but that nausea, no. That I do not like staying nauseous and staying sickly. I just feel sick constantly because when you have nausea, trust me, you can't focus on nothing. You're just so sick, and you just want that nausea to go away, to go away. Also, they put a different pre med in you. They actually put um, I'll think of it. Benadryl. They administer Benadryl in you as your pre-med before putting Taxol in you as an allergy offset. Um, Now, mind you, when you take allergy medicines of any kind, those are antihistamines that turn off certain receptors in your brain, so they can affect your serotonin level, your melatonin level. They're affecting that. So that bothers me too because Benadryl makes me sleepy. But if you take so much Benadryl, eventually your body just adjusts to it and it's not going to make you sleep anymore. Actually, it's going to work right the opposite. It'll keep you wired and because it's affecting your serotonin level. So a lot of these chemotherapies, they affect a lot of your receptors in your brain, and that's why they give you these medications for nausea. It's actually turning off that receptor in your brain so that you don't throw up, and or that you go to sleep instead of throwing up. So it depends on the medication. Uh, the steroids that they're giving you so that your body can tolerate, like pumps you up, so your body can tolerate the medication. Also to fight the fatigue and for nausea. So they have triple layers and double layers and maybe you never took medication before like me. I'm not used to taking any kind of medicine, not even aspirin or anything else. Just highly unusual if I take anything for pain or whatever. No, it's not being brave. It's just the fact that, uh, if you have tolerated something long enough, you can almost turn it off and ignore it. And by the time you feed yourself or eat foods or hydrate yourself, a lot of times it will take that pain away. It just depends on what that pain's coming from. So if I did take something, I knew it was temporary. It was going to wear off. It was just a one time. It wasn't going to cause me liver damage and kidney damage and things like that. So that's why I'm saying if your body's not used to it, you're going to be more sensitive. So your symptoms may be more intense when they show up. But make sure you report every single side effect and symptom immediately to the nurse, and so that and then when you talk to your doctor, your oncologist, whoever's monitoring you, make sure you report things when they ask you questions. Be honest and tell them the truth. Because trust me, there are so many things that they can do, that they can tweak and fix that and take that problem away, and be able to at least tell you where that problem's coming from, what that symptom's coming from, what's causing it, and always letting them know, because there are some people who simply cannot tolerate the chemo, who they just can't take the treatment anymore. They just can't. Um, and pray that you can get through it and it does its job. And that's what I'm praying, is that it just does its job so that I can get uh, cured of this quicker and put it back to its dormancy. Get rid of what's come awake and keep the other dormant. That's my goal. Get rid of the cancer that's awake, remove it, get rid of it, kill it off, and to keep the other cancer cells dormant and not wake them up and not them become active and run amok and rogue in my body, or move somewhere else in my body. So that is my overall goal. And do stay tuned for future videos, and I'll tell you as the progress continues, and I'll even tell you what results after my fourth chemo treatment of the red devil, and before going into Taxol, and keep you up to date. And this maybe answer your questions, give you some comfort. Leave comments. I will respond to every comment. Do like the video if you do, and subscribe for notification of the future ones coming up, because we're going to see each other on the other side. Stay beautiful, and know that Elizabeth is cheering for you. So if you do want to talk to me, just contact me or leave it in the comments, and I'll get back to you. Until then,